I believe that you should equip yourself on knowing what to do when your child gets a burn. Do you know what to do as first aid for your child's burn? Is your home safe from burns? Well, there are different causes of burns, serious injuries in young children, such as sunburn, contact with hot liquid, hot water, or steam, as well as from fire, electrical contact, and chemicals. All of these can cause serious and permanent injury to your child and can also cause scarring. In this video, we are going to talk about first aid for your child's burn. We are also going to talk about when should you worry and bring your child to the hospital, as well as tips to prevent burn accidents at home. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Burn treatment and prevention. What can you do at home? As quickly as possible, soak the burn with cool water right away. You can run cool water over the burn for 5 minutes or longer. Do not use ice as it can make it worse and delay healing, and do not rub it in because it can induce blistering. Also, before removing any clothing, run cool water over smoldering clothes right away, and only after doing this can you remove clothing. Remove clothing as much as possible, except those that are stuck to the skin. And also, if the burn injury is not oozing, you can cover it with a sterile gauze. But if the injury is oozing, you can lightly cover it with gauze and seek medical help right away. Do not put powder, grease, butter, or other folk remedies for burns because it can make it worse and can increase infection. Seek medical help right away for electrical burns and chemical burns. And also, seek medical help right away for burn areas to the face, scalp, hands, and genitals. When you're treating a burn at home, watch out for any increase in redness or swelling, or if there is development of bad odor or discharge. These can be signs of infection that may need medical help right away. So when should you worry and bring your child to the hospital? You should worry if the burn is a second or third degree type of burn, if 10% or more of the body is involved, if the body parts involved are the face, scalp, hands, genitals, or skin over a joint, when the child is young or very fussy and therefore difficult to treat at home. Now we go to tips to prevent burn injuries. First off, avoid smoking indoors. And then, do not leave food cooking on a stove unattended. And also, lock up flammable liquids in the home. It is best to store them outside the house, out of the child's reach, and away from heat or ignition sources. To prevent scald burns, adjust your water temperature. Make sure that the hottest water coming out of the faucet is not hotter than 120 degrees Fahrenheit or 48.9 degrees Celsius. Also, install smoke detectors in your home. Place them on the hallways, outside the bedroom, in the kitchen, in the living room, with at least one on every floor. And make sure you test them every month to make sure they work. Also have several fire extinguishers in your home. Place them in areas that are at risk for smoke, such as the kitchen. And make sure you know how to use them. As to the extension cord, do not place a lot of electrical equipment or appliances on extension cords that put too much load on the cord. And in terms of matches and lighters, keep them away from children, out of reach. Hey, if you like this video, watch my other videos where I teach you about other child health problems.